Hi everyone, thank you for standing by and welcome to the International Women's Day panel discussion. All participants joining the webinar today are in listen and view only mode. After the presentation, there will be a question and answer session, and you can submit your question anytime into the Q&A box located at the bottom center of your Zoom screen. This webinar is being recorded today and will be available for viewing on the NADA website in the coming days. I will now hand you over to Suzie Hudson.
Hello everyone and welcome to our NADA International Women's Day event. We're really pleased to have a range of panellists with us today, and I'd like to really start by acknowledging that we are all on Aboriginal land. Here at NADA, we're on Gadigal land as part of the Eora Nation, and I'd like to pay my respects to elders past, present and to future generations, and to acknowledge that all Australian land was never ceded. And really, I suppose we're very excited to bring you this webinar or panel discussion today because we know how important it is that we recognise the women in our workforce and, more importantly, those who are accessing support for alcohol and other drug issues. Our theme this year in 2021 is Choose to Challenge. And I think that's very important for us in the alcohol and other drug sector. We know that in spite of there being a significant amount of issues there in the community for women, that actually they access treatment in lower numbers than their male counterparts. And I think this theme is very fitting for us. It talks about a challenge world being an alert world where every person in the community has a responsibility to really think about their own thoughts and actions and how they engage people and women in particular. I think what we want to highlight today, and we know that a lot of our members actually celebrated on the 8th, which is the actual official day of International Women's Day, and we put on today's event on the 9th out of respect to them. We know there have been some brilliant events that have been held and recognition of the huge amount of resilience shown by women in the sector. And so we really want to mark that and to sort of really engage and I suppose hear from some of those that are working in the sector. I'd like to start by introducing and to sort of meet the panel. Sitting alongside me today is Michelle Ridley. Michelle?
Hello everyone, I'm Michelle, I'm the Clinical Program Manager at NADA.
Thanks Michelle. I'd like to also now introduce to you Louise Dunne. Louise.
Hi, yes, I'm Louise Dunne. I'm a mental health social worker and a counsellor and team leader at ACON Hunter. I'm really pleased to be here. Thank you.
Great, thanks Louise. And Raechel Wallace.
Hi everyone, my name's Raechel Wallace. I'm the Aboriginal Program Manager at NADA and I also work with Lives as well.
Thanks Raech. And Axel.
Hi everyone, my name's Axel. I am a caseworker at Guthrie House. I also do the intake and outreach at Guthrie House.
Thanks Axel. And Yalda.
Hi, my name is Yalda Latifi. I'm working as a bilingual counselor and psychotherapist at Drug and Alcohol Multicultural Education Center. I'm so happy to be with you.
Thanks so much, everyone. It's really important to us to have our members involved because this is really about you all out there, and we're so glad that you could join us today. The other really significant thing about today is that we are relaunching our 3rd edition of Working with Women Engaged in Alcohol and Other Drug Treatment. Here it is, everyone, and we would like to invite you at the end of this presentation to get in touch if you would like a hard copy of the 3rd edition of this resource. We're really pleased to say that it's an extremely popular resource here at NADA, and I think that really is a testament to the fact that people are wanting to challenge in the AOD sector. They want to know better ways on supporting women from a diverse range of backgrounds, to be inclusive, to really accept and acknowledge the impact of gender in the world, and I suppose to really think about what that means in practice. And so today, and part of the reason we have these special guests joining us, is to really focus on their experiences and what they know is important working alongside women in the drug and alcohol treatment sector. I want to let you know that in terms of some of the revisions in this third edition, we were able to really go back and explore specifically the areas that look at being more inclusive of diverse women from diverse backgrounds. And certainly we've had some input along the way from DAMEC, from the Drug and Alcohol Multicultural Education and Counselling Centre. We've had input from ACON and the Gender Centre, specifically around women from diverse sexuality and diverse gender backgrounds, and also, of course, those women who identify or who are Aboriginal and Torres Strait Islander. So we really think it's been important to involve the sector. And you will also, of course, know that the very significant role that our specialist women's services have played in the development of this guide. And so without much further ado, I'd like to really start to get some voices going from the panel. And I'd like to start with you, Raechel. And I know that you've been involved in lots of different projects with NADA, but actually, I'd like to know a little bit about what you think some of the key elements have been, particularly through the Aboriginal project. And also, I know you recently were involved in the co-facilitation with some Aboriginal women who were involved in treatment. What were some of the things that they said they thought were important? And over to you.
Thank you, Susie. So yeah, as just talking about the focus group with the Aboriginal women, and some of the things that they spoke about was in the importance of including cultural activities with treatment. So if they're in residential treatment services, having access to like Aboriginal services or being involved in cultural things that's happening in the communities where they are. Because a lot of time these women are coming off country to come into treatment. So
right. And so
also
they travel to there, that can be a bit of a challenge for them.
Oh, coming off country to go, yeah. They're leaving home, they're leaving their communities, they're coming, yeah. I'm talking about residential treatment, yeah.
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 Yeah. And so tell me a little bit about when they were talking about that challenge, were there things that helped them in terms of making them feel a little more comfortable if they were going into residential treatment?
Going into, I think having Aboriginal staff on your team, but also some girls talked about, so my other project I worked on Aboriginal guidelines, and I did some consultations across the state and talked with some Aboriginal service users. And one thing was one participant going into a residential service and having that access going to the Aboriginal women's group in the community really helped her in treatment.
That's great. So I suppose what you're doing there is bringing culture into the treatment rather than it being something separated, because, that makes a lot of sense. And so with that in mind, I suppose it tells us that linkages with other Aboriginal community-controlled organisations could be helpful.
Yeah.
And something for all the mainstream organisations to maybe think about.
Yep.
Thanks, Rach. And so we also are really aware that people from culturally and linguistically diverse backgrounds, they really can find it very difficult to access services where they feel heard and where they feel as if they're really included. Yalda, are you still with us?
Hello, yes, I'm here, sorry.
Yalda, I was wondering, from your point of view, what are some of the key strategies or best practice that you would say when people are working? I mean, it's a bit of a broad brush to talk about women from culturally and linguistically diverse populations, because we're talking about a broad range of people. But are there some things that people should keep in mind when being more inclusive?
Yeah, I'm working with Afghan and Iranian women who are using AOD, like alcohol and other drug, or maybe they are impacted with their family members. Because of that, I think that's very important to make a culturally responsive approach for them. I mean, they really need the people who can speak with their language and they are familiar with their culture. For example, they need healthcare providers or counselors or psychotherapists who are female because of feeling shy or shame to share their problems with men. They are not willing to get treatment. Because of that, this is very important that we consider that the biggest needs of these women are working with female people who are from their culture and they can speak with their language because of language barrier and cultural barrier. The people who can understand about their problems in their past, like trauma problem, gender discrimination, or other things that push them to come to other country for better life. But another problem is less awareness about how they can get services. Because of that, I think we need more advertise about different services like DAMEC, because most of them are asylum seekers and they are not with refugee status and they need Medicare or something. And always they're scared to go and get the help from different services because they think they need to have a visa, they need to have Medicare, and they may give free services without any Medicare or any another requirements, very free. But this is important that we can have a healthcare provider who are communicating with other community, like called background community, because always I'm advertising on Facebook for different Iranian pages about DAMEC and another services that can help these people. And one very important thing that is very important for these women, that they need child support and the facilities like childcare, daycare, that they leave their children to them and be comfortable and sit in the group or go and get different support from different services. There are 3 points that already I explained about that, but there are many things that called background women really need to go and get help from different services are available in Sydney specifically, because I'm working in Sydney, but they don't know about that. They are not aware that how they can access to these services. And this is very important that we make this environment for them to understand that they can get help, because this is Australia, this is not their country, and they can. Right. So, and many free services are available.
What you're saying there, Yalda, is similar in that theme that Raechel's talking about in terms of support and bringing the culture into the treatment. Language, of course, being very important as well there. Louise, for people from LGBTIQ plus backgrounds, and women in particular from LBQ backgrounds, are there some similar things around cultural responses or bringing community into treatment? What's some of your experiences with your clients?
Yeah, I think understanding kind of the context of substance use in our communities is quite important, and the unique experience of stigma and discrimination, specifically associated to their sexual or gender identity. And our communities are at higher risk of experiences of self-harm, of poor mental health, suicidal behaviours. And we know that drug use can be a protective strategy for people to manage these symptoms. So there are specific unique experiences for people in our communities around that, and that puts barriers in place as well. And I'll come back to the point you made about peer support and about bringing culture into support services. But I think it's important to highlight, I guess, some of the barriers and the issues that our communities face to begin with. And I think women on a whole face unique barriers to accessing drug and alcohol treatment, but particularly for the queer community, we've had poor experiences with healthcare in the past. People are really fearful about not being taken seriously. There's a fear of prejudice, discrimination from healthcare. A lot of people have experienced that previously, and it really affects their confidence to go and access other support services. Not wanting to come out, real concerns about confidentiality and people breaching that. And so I think just understanding, I guess, the unique aspects that people struggle with from our communities, it highlights then what people need and how we can enhance services. And I definitely agree with Raechel and Yalda that speaking to people who understand the experiences of sexually and diverse communities is really important. A high proportion of people don't go to mainstream services because they're not seen as queer affirming. They don't have the experience and the understanding of the specific needs, health needs, as well as social needs, emotional needs of the LGBTI community. Yeah, I hope that answered that question for you, Suzie.
It sure does, Louise. I mean, I think the real important, there's a very significant piece in the resource, particularly around that experience of stigma and discrimination. And I think that really gives us a focal point for what needs to be challenged, is to try to fully appreciate some of those experiences that someone has had to get through in order to reach out for help in the first place.
Absolutely, absolutely. And you know, I think unfortunately a lot of services aren't inclusive. Miseducation, you know, we're just the training hasn't been given, the education hasn't been given, and what services, I think there's some really simple things services can do to make their service more inclusive, more welcoming for community. Doing queer affirming training, things like looking at their intake forms. Is it reflective of the sexually and diverse community, or is it discriminatory in how it's done? Is the treatment trauma informed, holistic, person centered, and taking into account, like we've spoke about, those unique layers of stigma and discrimination? I think all of that would go a really long way to make our services a lot more inclusive for our communities.
Yeah, fantastic. Thanks, Louise. And I think in all these examples, I'm going to hand over to Michelle in a moment, but I think it's also that thing of thinking about the drug and alcohol treatment sector is a broad one, that there are various types of treatment and that there isn't a one-size-fits-all for people. And so we always need to be thinking in the sector about what are the plans for people when they leave a particular intensive piece of treatment, and how that care will go on into the community. And so I suppose it's very important for us to be mindful about how communities are involved throughout the treatment journey, not just when it comes time for people to perhaps leave an intensive period of treatment. So on that, in terms of coordinated care, I'm going to hand over to Michelle now to talk a little bit about what that means and what particularly we might need to be thinking about for women.
Thank you. I think for women in particular, I think for continuing coordinated care to be effective, it really needs to be holistic, and it needs to occur alongside the woman and not done for her, as in like developing a case plan or a care plan. It really needs to be done alongside her in a really holistic care plan. I think because what we know is, you know, problematic drug use doesn't occur in isolation. And for women who are accessing alcohol and other drug treatment, we know that, you know, they have higher rates of mental health issues, experiences of childhood trauma, domestic and family violence, homelessness, poverty. And unless we address and like work with them to, you know, to work on all areas, it's really going to be very difficult or maintain your drug and alcohol treatment goals, whether that be to reduce use, reduce harm, or to stop use. It's really important for continuing care, which can be wraparound support, aftercare, whatever that kind of form that comes in, is that it's that holistic treatment. And I think, as Yalda spoke about before in regards, I think a particular area that I'm very passionate about is supporting women who are pregnant or mothers around accessing AOD treatment. And we know that, you know, that it can be really difficult for mums to access treatment. And I think as part of the revision of the book, we've updated the chapter on working with pregnant women and mothers, and particularly around you know, effectively working with Child Protection Services and DCJ, Departments of Community and Justice. We've updated that part. But also, I think when we're working with mothers or pregnant women, it's really important for all AOD workers to really have a good understanding of what their healthcare needs are, what specific kind of areas you need to support them and around mothering. And also there's a lot of stigma and discrimination towards women who use drugs, and particularly mothers who use drugs. So I think that's a particular area that if you're providing continuing care is providing support around family inclusive practice.
Great. Thanks, Michelle. And I think, you know, we will, as we go along, be talking a little bit more about particular groups who have experienced along the way a very particular set of discrimination. And I know that for yourself, Axel, working with women who are coming out of the criminal justice system or who have had involvement with the criminal justice system, that's particularly difficult. Do you want to talk a little bit about your experience working at Guthrie House around the types of challenges that women have when they come in and that are explored in your setting?
Yeah, so Michelle touched on the stigmatization of drug use, but there's also, for our group, there's criminalized women who are stigmatized as well. And this group particularly needs a really clear gender responsive access to services. The majority of our clients come through really highly traumatized. Most of them, over 90% of them, have family violence, DV, or sexual assault, you know, that they're living with. Drug use is often, you know, a form of self-medication. And so when we're working with our clients, as you were saying before, it's always a holistic approach, and never just about the drug use. It's about looking at the homelessness that's created by going in and out of jail, cycling through jail like that. The networks and families that are, you know, they're isolated and broken up from families because they're cycling through jail. And so, you know, the work that we do, the case work that we do with them is always focused on all of those aspects, not just drug use. And often if you can work on some of the trauma, you know, the family and network connections, the homelessness, then often the drug use stuff can correct itself. I mean, you have to have an element of drug and alcohol work in there, of course, but it's not the
Yeah, so I think you're quite right about that. I think, you know, we can get very hung up on, you know, and people talk a lot about what are the outcomes in terms of drug and alcohol intervention, but what everybody's been talking a lot about is that need to really be thinking about all the things that actually create a foundation on which people perhaps, you know, their alcohol and other drug use may become more of an issue as a result of some of these other things that are going on and these experiences. And go ahead, Axel. So tell me a bit about what does that look like for some of your clients? You talked there about some of the trauma they're experiencing.
Look, I mean, yeah, I mean, I think often relapses or drug use or the relationship with drug use can reappear towards the end of their stay in the program when they're facing the idea of going back into the community, and that can be really quite scary. And their go-to is, I need to not feel this. This is too much for me. I don't know if I can do this. I don't even know where to start. And so, you know, when you're talking about chronic drug use and using drugs as, you know, a way of surviving, a way of not feeling, a way of numbing what they've been through, yeah, that can be quite challenging. You know, in a 3-month period, it's very hard to do some of the deeper work that needs to be done. And that's around the trauma. And sometimes it's not ideal to pull that trauma up, or to, you know, to suggest that going to psychologists or counsellors at that moment isn't necessarily the right thing to do, just because it can destabilise a woman who's just trying to get on her feet at that moment.
And so at that point, you're really trying to work very clearly about, as you said, stabilising or organising those basics.
Yeah, and also that thing of, you know, offering an outreach program afterwards, and stable housing, that kind of stuff. Once that's in place, somewhere down the track, bringing in counselling and, you know, that sort of work.
Yeah, so that speaks, I think, very much to that theme of internet, you know, of choosing to challenge, which is about saying, whilst we're here specifically around drug and alcohol use issues, it's all these structural things, and that I think International Women's Day particularly highlights, that are recurring themes that frequently we find quite challenging, particularly when there are a lack of resources. So I want to sort of start to talk a little bit more broadly now to all of you and bring you all into the conversation at this point. We've talked a little bit about those structural things. Can we talk a little bit more about that experience? Like, what are some of the things in your experiences have been useful, helpful to women accessing your services around some of those key things, around homelessness or around their experience of trauma? Perhaps, Louise, could I start with you and just a bit about, you know, you spoke very much there around that experience of stigma and impact and trauma. What are some of the things that you find work quite well in your service in terms of working alongside the women accessing your service?
Yeah, it's great that we're talking about trauma. I think often, like we've talked about, we focus on the drug and alcohol use and the change in that behaviour. And like Axel was talking about, you know, it's a symptom of really, for many, many people, trauma. And I guess how ACON, or how we sort of support people around this, is really using a trauma-informed approach, which is very gentle. It is very careful. Like Axel mentioned before, sometimes it's not going there. You know, it's really assessing where this person is at this particular time and where their mental health is at that particular time as well. What resources have they got? What supports have they got in place? You know, to really to say to someone comes in and they want to reduce or stop using or whatever, if that is the way they have coped in the world for years and years and years to deal with trauma, and they suddenly stop, then it's going to cause, there's going to be an effect, you know, and it can be different for everybody, but there is going to be an effect. And so a lot of the work we're doing is really trying to find, okay, if we remove this source of coping, then what can we build? What can we put in its place so that you have some resources and you have some support to cope with the world? And at some point it will get easier, but in those initial few months, it can be really, really tough. You know, and so I think just that gentle walk alongside, like Michelle mentioned before, what do you want? What do you need? Are you here? Why are you here? You know, and then that's where I meet you, and then we walk together.
I think that's really important, Louise, because sometimes workers might think they hear about a lot of trauma women's experience, so they want to focus on that. We have to fix the trauma. We have to address that to be able to then work around the drug use. But until that isn't necessarily helpful. And I think it's really important. What you're saying is that we need to work alongside the woman and not, you know, we might think, oh, you have to address that trauma, but it's not necessarily always going to be to work like that. So I think that's really important.
And just to finish as well, I think, you know, to combat that stigma and discrimination, and this is something that we probably talk about, we've been talking about for a long time, but, you know, it's just no judgment. There is no judgment here. If you used from when you were 10, if you used when you were pregnant, if you used with, it doesn't matter in this space, there is no judgment. It is safe, and then we can, you know, people can start to be vulnerable if there is a sniff of judgment, because, you know, if I'm a user, then I've experienced it. I'm looking for it. I'm looking for people to judge me. I'm looking for people to, you know, and so it is so important that we have safe spaces where people can be honest, be themselves, and not feel threatened, you know?
Yeah, that's the essence of trauma informed, isn't it?
Exactly, yeah.
Yeah, I can see you nodding there. Is that very similar for your clients, that judgment can be a really big issue for clients coming through the door?
Sorry, go on.
Sorry, I was thinking they called my name. Sorry, maybe it's because I cannot hear very well. Yeah. Are you talking with me? Yes. Yeah, just one thing, I do not want to talk about judgments right now, because I think before everything, in my culture and Afghan culture, women, I think they need education about mental issues, mental illness, and about, for example, they do not have to think that as a coping strategy, they can use different medication or drug to help themselves, for example, because of pain or because of different problems. Because when we are talking about trauma, I know, and I have this experience with the clients, that they don't know about trauma. They don't know about mental illness. Even they don't know what is trauma, what is depression, what is stress. And when they come to our sessions, slowly I explain for them about different mental issues, and they get education that what is pain is coming from, and they understand this is trauma. And unfortunately, they are getting re-traumatized with the men who still are communicating with them because of language barrier. They are communicate with the men like their husbands, brothers, dads, or other Iranian or Afghan people who are abusing them. Still, they are abusing them. And they have to be educated with their rights, law, and everything that can be helpful for them in this new country. And after that, when we educate them in this situation and explain for them about different abuses, different mental illness, then they feel safe with us, because they feel that we are helping them. And when they feel that we are helping them and supporting them, automatically they feel we are not judgmental, because we are supporting them. We are not against of them. We are with their side and we are helping them. And of course, being non-judgmental is very important, but I think it's on further steps, not in first step, because they need many things more than these things that we are talking about, because we are talking about the women, even still they don't know many things about their physical and mental. And we have to first explain what is this very simple things that we know that, but they are not aware about this. Yeah.
And that education is so important, isn't it? It's not just about there's very important issues, Yalda, around what is trauma, why do I feel the ways that I do, but also about the health system itself, how to get help, and where that can be found. And you've all talked a little bit about where to go and how to find the support that you need. Raechel, in your experience for Aboriginal women, what we do know is that although there may be some issues being experienced by Aboriginal women, they're less likely perhaps to reach out for that help.
I was going to say that you touched on a good point in the beginning, like a lot of males access services versus women. So like I used to manage a service, and you know, when we do our interview stats, we'd have 70% males and only 30% of women. And I think it's trust as well. So women coming in and able to tell their stories, because there's that fear of losing their children. So when we look at the rates of child removal for Aboriginal and Torres Strait Islander children, it's very high. So trust is, yeah. I think that's a fear for Aboriginal women to access services because of that.
And taking that time, and I suppose that's what we're all saying, is that there's time that needs to be taken to build that trust.
Yeah, and rapport.
Yeah. And so sometimes, you know, and that's the other challenge for us, we're talking about choosing to challenge, is the way in which a lot of our services are delivered are very brief, you know, and as you've described there too, Axel, you know, in this particular program, it might not be the case that someone can start to unpack some of those issues. And so trying to pitch the service that takes the time to get to know someone, to create a safe space, as you were saying, Louise, and still try to address some of and build some of the goals that people have can be quite a challenge. What about for your staff? So people that are working alongside women, what about some of your female staff? How do you keep them healthy and safe and support them? What sorts of things are happening in your organisations around that sort of support?
Who are you asking?
I can ask you. Go ahead.
We have a really good. Our team is small and it's quite. We have like debriefing. We have good communication structures in place. We do group supervision together. Yeah, so I mean, I think in terms, it's very easy to sometimes get lost in the work that you do, and you can end up with vicarious trauma. And so those systems of supervision, both group supervision and you know, supervision with managers is really, really crucial. Yeah, we're hearing.
Yeah, similar to Axel. We have clinical supervision, regular clinical supervision. We also meet as a team as well weekly, which is good. But I think, you know, we've put a lot, and this is like ACON Hunter where I'm based, we've put a lot of time and energy into the culture of the environment and the workplace culture. So you know, we've built this little garden outside and we go and sit and have meetings out there sometimes. Like we try and, like it's heavy work, like it's big work, you know, there is a lot of trauma, there is a lot of stuff you have to hear, which is really sad. And it is, you know, it's painful stuff. And so balancing that with time out to go get a coffee or go for a little walk or go and sit in the garden, and it's the same stuff that I talk to clients about, you know, having those experiences and those moments of joy and relaxation and mindfulness or whatever, so that you're able to get through the day. You know, we try and walk the walk as well.
And Yalda, in your organisation, in DAMEC, are there ways that you support each other as women in the field?
Yeah, of course. We have clinical supervision and clinical meeting. As you know, in DAMEC, all of us are from different culture and different language, and we completely understand the situation of each other, and we try to help each other. Always we try to get different training, different workshops, and we try to help each other with meditation or something like different self-care that we share with each other about the experiences that we have. Yeah.
And Raechel, you have been involved in some projects specifically around supporting Aboriginal staff. How important do you feel like it is for Aboriginal staff to have an opportunity to get together?
I think that's very important. Yes, I think it's very important they get together, come together and support each other and talk to. They feel more comfortable. We feel more comfortable talking to each other about our issues and yeah, I think it's very important.
I think that's similar in the queer community as well, that a big part of the work we're doing, people might come to us for counselling, but more often than not, they're seeking connection with other people from their community. You know, they're seeking to people who get them, people who understand, people that they can relate to. And so, so that can be a big part of the work we do as well, is really connecting community together.
Yeah, and so, and I suppose, Axel, that also speaks to the importance of having women-specific services, like the one that you're working within. Can you talk a little bit about why you think that is important?
It goes back to, you know, trauma and violence being one of the key factors for women coming out of jail, that having it trauma informed, which is what, you know, having a gender specific type of service is about, can really address.
Yeah.
Safety.
And saying, Louise, safety, that feeling of being in a safe space, that allows people to then to start to build the trust and think about a possible different type of path, perhaps, or to feel like things could be different or improved.
Yeah.
And so at this point, we might see if we've got some questions coming in. I'd like to invite you all online now. If there are some specific questions you have for a particular panelist, or if there's some particular thing that's been on your mind, we would love to hear from you now. We have down at the bottom of your screen, you may see a Q&A box. You can put your question in there anytime. And it might, for some people, if they're using an iPad, it might be at the top of their screen. If you click on the Q&A and you write your question in, we will respond. So I'll turn to some of those questions now. The first one says, how can we get better at recognising and responding to domestic and family violence in an AOD treatment setting? So I might start with you, Michelle, if you don't mind.
I think one of the really important things is all NGO health services have a responsibility to screen for domestic and family violence. So we should be asking the question and asking women who are accessing our services, you know, that we're concerned, or just screening for family and domestic violence. I think that that's really important, because if we don't ask, it's very hard to know. And I think that people sometimes say to me, oh, well, I'm worried if I ask, it'll, you know, it might kind of ruin the relationship, you know, the therapeutic relationship, or it's something I'm going to ask down the track. But if we don't screen in the intake when we're first meeting someone, I think it can be, you know, a real gap.
A missed opportunity.
Yeah. And NADA, we do have a screening tool that's built into NADA base, and I think Suzie and I are very happy if any members that are watching today would like support around that. But I think it's just, yeah, it's really important to ask and ask in a way that, you know, you just have concerns, or that it's the standard question that we ask everyone, so someone doesn't feel like they're being, you know, kind of pointed out or whatever. But yeah, I think that's a really important way to firstly better respond.
Has anyone else wanted to talk a bit about their experiences in terms of really being responsive to picking up on family domestic violence?
So at ACON, yeah, following on what Michelle was saying, definitely part of our intake and screening is to ask the question first and foremost. And we've also had a bit of funding over the last 12 to 18 months to develop a specific website for LGBTI community, because domestic and family violence can look quite different in our communities. There's other ways of control and cohesive control that can occur in queer relationships, and a lot of similarities, but a lot of generic kind of mainstream services are very hetero kind of normative models. So there's been quite a lot of work that we've had to do in this space to make it again more inclusive of our communities, and we're also going to be running programs for survivors of domestic violence and also people who use violence. So, and I think this is really important work because a lot of people from our community really struggle to access domestic and family violence support in mainstream services. Yeah.
And just following on, I might stay with you, Louise, if that's okay, because there's been another question come through. I do want to come back to some of the family and domestic violence side of things. But one of the questions come through about how we can be more inclusive in terms of queer communities as an organisation. Is there an assessment or screening tool for organisations in terms of being responsive or trauma-informed around queer communities? Are there things that people can be doing to ensure that perhaps they are asking the right kinds of questions if people identify as sexuality or gender diverse?
Yeah, absolutely. So ACON kind of provides a 3-stage support, if you like. So we do in-services for services all the time, but I think what this person's talking about is more like training, pride training. So that is training around how to make your service more inclusive. We also have Pride in Health and Wellbeing, which is a membership program. It offers mentorship, staff development and training. It offers kind of embedding LGBTI inclusion throughout care provision policy, quality improvement, and a tool that they Pride in Health and Wellbeing developed is an audit tool. It's free, it's 5 minutes, and it can measure your organization's LGBTI inclusion kind of rate. So that's a really good step to start to really see how inclusive your service is, and then maybe what support somewhere like ACON can offer.
That sounds great. And so, Yalda, in your experience, if we're talking about specific women from a specific background, is DAMEC another good place for people to go if they wanted to find out better ways or to link women from different diverse backgrounds in with support with your services?
Yeah, but I do this myself with my culture, as I explained for you before about language difference and limited language skill. In my community, people cannot communicate with other people with English language. Always I try to do this myself. Always I'm advertising in different Iranian pages about DAMEC. I explain even in writing or even in live explanation on different Iranian Facebook pages, or I try to attend in different communities events, and I try to explain about the situation that they make for the people to get services. But one thing that's very important is that Iranian women are not tending because of feeling shy and shame, and this is very good that when we go to different place, just be advertised, not to focus on drug and alcohol. And when they see the websites or cards or whatever, they can understand that they can come. But if I want to explain specifically about drug and alcohol, they are not tending to come because they think maybe it's impacting on their visa issues or Centrelink or payment, and they feel fear to come. Because of that, I'm very careful about advertising or introducing DAMEC as services for AOD. Always I'm trying to explain about healthcare provider, not like exactly about, yes. I try to censor this work, and after that, when I see them, I explain more about the different services that this organization make for drug and alcohol use and or mental illness even. Yeah.
So trying to really tap into different ways of engaging with women. And that leads me neatly onto the next question, which is really about what some of the ways we might encourage women to become more active participants in their treatment. So if we're thinking about that sort of collaborative care planning, or asking them what is it that they need, does anyone have any sorts of things that they do to invite their clients into that process?
Yeah, I mean, I think if you're talking about, for example, DV, often with DV, that's not something that we would screen, say, at the beginning, because our women are in jail. So we try very hard to not trigger them. And often their life stories come out when they're at Guthrie House. And so that's always a really good opportunity to do different types of group work. And in a group work environment, group work environments can be a safe place for women to address some of their, deeper issues that they may not otherwise do, say, on a one-on-one basis with a case manager, because they have peer support there.
So sometimes it's about trying different ways of engaging and mixing that up a little bit, Axel.
Yeah, that's right. That's right. And we'd run DB groups. We run various different living skill groups, apart from the drug and alcohol groups that we run as well.
I was going to say also in relation to parenting and women who are parents, I think where possible, making the service as inviting for mothers, and where we can, wherever possible, and access to like childcare or children, kind of make it child friendly, because I think this kind of sends a sign to the mum that it's okay, and that it reduces the stigma, and it just and also we know that childcare issues are really tricky, and I know that a lot of our services are under resourced, but if there's any way that people can or services can enhance their setting to be more child and family friendly, that's always definitely a really helpful thing to bring women along and support them in being an active participant in their treatment.
That's a really good point. And Raechel, I'm wondering about settings in which Aboriginal women may feel more comfortable if they're able to bring families.
Their children, yeah, because a lot of time when Aboriginal women are coming into your service, there's a high chance they may be bringing their children with them. So just having that space where, even if you have a bigger waiting room, which I know sometimes you can't in some services because, your service is limited, but having toys there or something in your waiting room, just promoting that your service is more child friendly. Yeah, that they can bring it. But, yeah.
So I suppose you're signalling, I mean, that's something that everybody's been talking a little bit about today too, is the environment. So having a culture within your setting that is inviting for people, that can reduce their anxiety about being there in the first place, that has an opportunity for them to come, whether it's with family or with children, to bring someone along, to engage, as you were saying, Yalda, in an activity perhaps that's not specifically, say, this is about drug and alcohol treatment, but this is about getting together or somewhere you can come and be. And I think quite a lot of our services have tried really hard to have more relaxed opportunities for people to get together, to get to know each other, to get to know a service. And then weave some of the drug and alcohol, practices and interventions into that space rather than the other way around. One other question that's come through is about, what does the research tell us about the women we see accessing treatment and who is missing? So I might say that from NADA's point of view, so we have a large, as you know, our members feed into NADA base, which is our data repository of the treatment data. And what we do know is that women who are entering our services, as we said, are in lower numbers to their male counterparts. But also in terms of their levels of distress, so that is measured in terms of their mental health distress and their general health and wellbeing is at higher rates. So people are feeling more distressed, and in terms of wellbeing, feeling like they have lower experience of wellbeing, greater experience of financial pressures, and certainly in terms of that feeling of self-worth. We know, but on the flip side, what the evidence tells us about women who do make it into treatment is that these symptoms improve. So they, generally speaking, across the population, there is a significant improvement in terms of their experience of treatment. What about from your point of view, Axel? Who do you think we're not seeing in terms of treatment?
Who's not seen in terms of treatment? Are you? Would you say outside of the? Am I talking outside of the scope here in general?
Yeah. I just wonder. I wonder, in terms of the people who can't maybe get access to your service, Axel, or is it that they're coming quite late in the piece?
Oh, look, there's another topic all on its own, which is trans women accessing women's services. Still a very difficult.
Go ahead, Axel. Please. Tell us more.
I think women's services have been a little bit slow to embrace trans women, and I think that is starting to change now. But I've been at Guthrie for 10 years, so I've seen it a span of time, and I could say now that those barriers are starting to break down. We are looking at different ways that we can include trans women, and it's usually not just about the organisation or the team or the boards. It's around education of other clients and how we can keep trans women safe in those organisations.
Really, really important point. Axel, carry on, Louise.
Yeah, I'm just really glad that Axel's brought this up, because I think it's hard enough for women to access support, and then you just add layers upon layers upon layers of stuff, and for a trans woman, there are layers of trauma, there's layers of discrimination, much higher risk of mental health, self-harm, suicide, drug and alcohol, domestic violence, homelessness, and then much higher risk of stigma and discrimination from healthcare services. People, the stories I've heard from people who've gone to ask for help and have been really inappropriately treated, they've been disrespected, abused at times by GPs, by health professionals, emergency departments. So, it's really hard, I think, for a person from that community to feel confident that they're going to be safe, which is just awful. And then we have services that are set up not in a way that is inclusive of trans women. And another, I guess, factor, for us, we cover a huge geographical area. Trans women in regional New South Wales, another barrier, another barrier for people to access support. Where do they go? Who do they speak to? Transport, finances, all that stuff. And I really think a lot more attention needs to be spent about how we can reach this community and how we can best support this community. And the best way to do that is to speak to people in this community. What do you need? What is going to work best for you, so that we can work with mainstream services and to make them more inclusive.
Couldn't agree more, Louise and Axel, and I think it's a really important piece of work. And certainly we feel that that's been better addressed in this edition of the guide. And what we do know is that a number of mainstream services are doing better in this space, but there's still a long way to go. But certainly through organisations like ACON and talking to people themselves, and we've been very fortunate to have consumers educate NADA, particularly around better ways that we can support our members around being more inclusive of trans women. And I think it's just really something that we continue to focus on, and really, once again, about challenging, choosing to challenge. And I think that's, really, really important.
I was just going to mention in our NADA, we recently worked with UNSW to do access and equity research. And one of the things that came out, and I think is so important, and Louise, you touched on that, is consumer participation. And if we don't talk to people that are using our services, engage with them, it's really pointless, really. So, so I think one of the things that came out of the research, and which was qualitative research, it interviewed a lot of people that accessed our member services, and a lot of them were women. And what was one of the biggest things that helped access to treatment was peer workers, people with lived experience, and I think that's a really important thing, and it's something that I know NADA and NUA and that we're working on. And one of the things that NADA has developed was the consumer participation audit tool. I just have to give you a plug out for that, because so we have a new consumer coordinator starting soon, and part of that is they can go out and do the audit tool with our members' services to see where you might want to identify where you can improve your consumer engagement. That might be having an advisory group to your board. That might be just ways that you can involve consumers in the development of policies. Just, I suppose, enhance your consumer involvement. And I think, and particularly around supporting peer workers, and I think that was something that really came out really strongly in that research. It's around having, seeing someone or a worker or someone in the service that has that lived experience, has that same experience as them, is really, really important.
Absolutely. And so, thinking again about the theme, I just wanted to return briefly to that. It's around choosing to challenge, that it's everybody's responsibility to be thinking about women, the experiences, as we talked about, stigma, experiences of violence and sexual assault, we know are particularly high, and a particular issue for people, women, should I say, accessing drug and alcohol treatment. And certainly the need to really raise the profile and dismantle the stigma that's experienced, particularly by women in relation to drug and alcohol use. Much of the research would indicate that women have that higher level experience of stigma, given historical and traditional roles of what it is to be a woman. And I think over time we try very hard to challenge that. But I want to invite the panel at this point to think a little bit about that theme, and anything that they wanted to share with our audience about what choosing to challenge might mean for them in terms of their work and the clients that they support, or the consumers that they support. Is there anyone who would like to begin? Perhaps just in terms of where do you feel like we need to choose to challenge in terms of the drug and alcohol treatment sector? It's a big question for you. Louise, do you want to start?
That is a big question, Suzie. So choose to challenge the AOD service. Look, I think for me, what comes to mind is having a flexible approach to treatment. That I think a lot of places or a lot of therapists have an approach that they use, which is fine. But I think for me, what I've tried to to always do, and whenever I've done training, whenever I'm speaking, is to look at all the options, is to be as flexible as possible. One approach to therapy or counselling or recovery, whatever term you want to use, is not going to work for everybody. We have the research, and we have the training, and we have the knowledge. So that really, for me, is about saying to the woman, okay, these are your options. You're telling me this is what you want. I can support you access this, or this. And we can just figure out along the way what's going to work for you. So I think just in choosing to challenge for me is really just that mindset of this is the right way. This is how you recover. This is how you get well, or this is how you change your behaviour. When actually what we've talked a lot about today is the complexities and the layers, and that every woman that we work with is an individual and has a completely individual experience of addiction and of life, you know. And so really challenging that idea that, you know, for some clients, we've started therapy and it's ended up being yoga that has given them peace and healing. It's not been, you know, going to the trauma. It's not been talking for hours about drug use and childhood. For a lot of people it is, but for some people it has been connecting with something that's going to bring them joy and peace and healing. And that is just as important and just as valid as any other journey that somebody might take, you know.
Beautiful. Thanks, Louise. I might throw now to Raechel. Raechel, is there anything in particular that you would want the people listening today to be thinking about in terms of challenging themselves or their mindset in terms of women, or Aboriginal women in particular?
I'm not sure, but I really like what Louise just said about being flexible. And I guess for some of our mainstream services, there are, like, when you're working with them and treating women as individuals, there's Aboriginal tools out there you can actually use when working drug and alcohol with Aboriginal women. So supporting your staff to be trained in those tools, and yeah.
Fantastic. Thanks, Rach.
That's a big question.
It is a big question.
Yes, just after bringing the women to the organization, the very challenge. First, I'm thinking working with women is, for me, it's very hard and challenging compared to working with men, because they do not talk. For many sessions, I have to work with them and talk with them and use different modalities and approaches to make trust, rapport, and intimacy between myself and them, to speak about their issues. And most challenging things for me to work with these women after bringing them to the services is ask them that, for example, what kind of drug you use. Always they try to deny that they are not using drug or alcohol or something, or for example, they tell me, okay, just I'm using a medication, this is not drug. But it's very hard for them to talk. And after that, one more thing that's very challenging, that most of these women are abusing by the men around them, and always they stop them to get treatment because sometimes they are misusing these women. For example, carry drug or supplying or something like that. Because of that, these men do not let them to do any treatment and get any help for getting this treatment or therapy. Because of that, that's very hard to work with them, specifically about trans women that you were talking. Unfortunately, I do not have any person to tell me I'm trans, between men and women, specifically between men, because they feel shy. Still, they cannot open their mind, specifically in this country. And this is very hard to bring up their problems. And as a counselor and psychotherapist, I think this is very challenging to make education and explanation for them that this is new life in new country. And when we are working with women, this means that we are working with many things, women from other culture, like my culture. For example, they are challenging with domestic violence, they are challenging with mental illness, drug and alcohol use, language barrier, education barrier, career barrier, many things they are challenging, and that's very, very challenging to work with them. But I'm sure that they are very vulnerable population in our society, and they really need support and help for themselves. And I think as a counselor, I'm very proud that even one small changes that I can make in this community and this population, it would be a lot, because they are growing the children for this society.
So right, Yalda, that we can sometimes forget as people providing treatment that even very small moments that we might not, we've got these perceptions, and we've all said this, we might have our own agenda about what we think needs to happen. Being able to step back from that and understand that maybe just that moment with you, however small, can be that first moment of trust. Yeah. And so recognizing that and not being on our own journey, being right alongside someone is so important. And so, Axel, for you, in terms of challenging, or how we might choose to challenge. Oh, sorry, you're on mute, Axel.
Sorry. I would say that as services, one of the things that we need to challenge is making judgments and assumptions about our clients, because that can create barriers to accessing services, and clients pick up on those little, behaviours that we may have, or, things that we might say that are judgments. And I think it's really important that we always check ourselves.
Mm-hmm. Yeah, thanks, Axel. It's a tough one, isn't it? Because we inherently can be, we think we're not judgmental, but I think sometimes it's exactly those things. It's about creating environments where we can be reflective of the things that we're doing, be open to more education for ourselves.
And I think that also means that we have to consider our own self-care, because that's often when people can make judgments, or tiredness or lack of self-care can add to that.
That's a big part of it. And
you're absolutely right.
And as human beings, we have prejudice. Like we have, we have to compartmentalize things, otherwise our brain will just explode with all the information that we take in. So it's such a human thing to have those prejudices, those ideas or stereotypes. But like Axel said, I think, just knowing yourself and knowing exactly when when my bucket gets a bit full, actually I need to look after myself so I can be the best for my clients. I thought I'd just mention one other thing, Suzie, that's popped into my head about choosing to challenge. And I think it's definitely come a long way, but there's work to be done around drug and alcohol services working with mental health services, like you've in the Yellow Book, working with probation, working with police, working with schools, but I think that the main one, the mental health, drug and alcohol services working together, it's definitely getting better. I don't know if anybody saw the Addicted docu-series on SBS, but it showed the model that they used in Melbourne, and they talked about it being this model that was kind of out there and different, and it to me it was like, that's how it should be. That's how we should be working. People have got access to all the health professionals they need. They've got culturally appropriate support. They've got peer support as an option. They've got therapy as an option. So I think that, I really hope that, and I think that is the way we're heading. But I think there's still work to be done in that space as well.
Yeah, I couldn't agree with you more, Louise. And I think, what we've been talking about today you know, is that it takes a team. It takes a team of people, and we, you know, one of the things that I suppose we wouldn't mean to claim, but I do think that women have a, you know, can have a perspective of trying to do things in a collaborative way, and I think that there needs to be a lot more of that. And I think, you know, that's also something that NADA can work on better too. Is how do we support our member services to work together with other services across, and certainly Michelle has been doing a lot of that work, particularly with DCJ. Because we know that if we work better, more collaboratively as workers, then that obviously has a payoff for our clients, who find a lot of these systems very difficult to navigate, because they are difficult to navigate.
And I think for me, or what I've observed the 20 years in this sector, since COVID, one of the more, I suppose, positive things that you could say has come out of that is people have got more technology friendly, and they're a bit more savvy and doing Zoom meetings and linking in. And I think what I've seen with DCJ in particular is a real kind of motivation in people to come together, and we're seeing a lot more kind of cross-sector meetings, but also meetings where people are getting together where they might be, you know, in various locations across the state. And I think that's something that's been really a positive thing. And I think also that people too are seeing how important, like you said, Louise, to work together. And I think for me, that's what I've been seeing more, particularly since more people have gone online, they're more willing to kind of, you know, to do the Zoom meetings and touch base and work more together. So, yeah.
And so I think, you know, one of the key things that we have tried to sort of demonstrate here is that there are lots of different points of view and lots of areas of expertise that we can actually draw on. And so for those of you in the audience, we would really strongly encourage you to reach out to other members. And that's the other thing that NADA is about, is we're nothing without you. This is a network of, you know, different workers from different perspectives. And so our job is to connect you where we can. And so if there are any people online who would like to reach out to find out more about different ways of working, about different people working with specific populations, we can absolutely support you with that.
And we do the, so we've got, NADA has the clinical, Women's Clinical Care Network, and so that's open for anyone who works with women. And we do a community of practice online every 2 months, and we try and, I suppose one of the main things is our members updating each other and talking about their practice and trying to get potentially a presentation from one of the member services. So if there are anyone on the line that would like to join up, please feel free to email me. It's Michelle at NADA. So yeah.
So as we are starting to wrap up, I'm wondering, I can't see any, I'm hoping if there's any other burning questions that people have, they could send those through. But I do want to give my greatest gratitude to everybody that's joined us today on the panel. It's really been so important to have you here, and certainly to have the words that you have been saying echoed in the resource, which is really fundamentally about considering women, considering their unique challenges, being as inclusive as possible in terms of, you know, identifying as a woman, to really consider the nuances that are there in terms of the types of issues that women may present with, and to really be as responsive and client-centred as possible, taking into account those experiences of trauma, working and walking alongside our clients and inviting them in to their own treatment, their own support, and remembering that that doesn't happen just within this room or this residential facility. It's how does that go back out into communities? How do we ensure that we're supporting others? You know, that whatever people are learning within the context of treatment, they're carrying that outside into their actual lives. I suppose always remembering and recognising the huge amount of courage that it takes for any person, and women in particular, to reach out in support, to ask for that support. So just in these closing moments, I want to just ask the panel, is there any other thoughts they wanted to share before we wrap up today? Yes, go ahead.
I just have to give a plug out to the NO conference as well. We have some amazing women keynotes. We have Felicity Ryan, who does some amazing work with NADA. We have Jenny Anthonisz, and we have Karen Urbanowski, who'll be presenting from Canada, unfortunately. But and we have a specific stream around working with women, and we've got some really, really good presentations from a range of different services, different sectors. So just wanted to give a shout out to our conference. Sorry, Suzie.
That's okay. The program is online, so you can check that out. To the panel, Louise, any final words before we sign off today?
Look, no, I've just really enjoyed it, and I'm really grateful to have been asked to participate. So thanks very much.
Thanks, Louise.
Thank you so
and
much.
Axel, any last words for you?
Same with me. It was really nice and enjoyable to be able to talk about these really important issues. And yeah, thank you for having me on.
Thanks,
Thank
Axel.
you.
And Yalda?
Yeah, thank you so much. It was so nice to join to this panel, and it was my first experience, and I really enjoyed. Thank you so much. Yeah, and the topic was very important, and I think this is very good. It was very good discussion. Yeah, thank you so much.
Thanks, Yalda. And Raechel?
I also want to say thank you, but also if women are coming into your service, they're taking a big step, especially Aboriginal women, to come into your service. So making your service for Aboriginal women more culturally safe for when they do access your service.
Thanks, Rach. Thank you, Michelle, my friend and colleague, and thank you all for joining us today. We really appreciate it. If you would like your own copy of the yellow book, please get in contact with Michelle or myself. We also, I'm sure the panelists would be happy to speak with you if there was something that you might want to ask them in particular. So get in contact with us in terms of their details, and certainly these are our details, so you can contact us anytime. But really, once again, thank you all for joining us. This has been a really important NADA International Women's Day event, and we hope to be celebrating future ones in person with you in the next year. So we hope to see you at our conference. Please get in touch with any queries or questions you may have. And thank you again to our amazing panel, Louise, Axel, Raechel, and Yalda.
Thank you,
everybody. We'll see you.
Thank you. Thank you.
Bye.
Thank you. Bye.